When a diagnosis of cardiac arrest is made, the first aider will have to do CPR. CPR involves 15 chest compressions and 2 breaths in cycles of 4, and then rechecking the pulse. The correct hand location for doing your chest compression is to come up the rib cage until you have 2 fingers on the bottom of the sternum, not below the sternum. The sternum is the chest bone. And then you'll take your compression hand and put just above those 2 fingers. That will give you the proper location. In general, your mid-chest is where your compressions will be. Also, your body position when you make the diagnosis is important. Because of the difficulty in compressing the chest, you'll want to get in a position where your hands and shoulders are straight above the chest so that you can use your weight as a dropping action, or your waist as a fulcrum, so that your compressions will be made with your weight as such, rather than trying to compress with your hands, because you'll find that to be very tiring. Also, you must remember, and this is in our textbooks, that the chest compressions for an adult type victim will be from 1.5 inches to 2 inches in depth. So it isn't good to just barely push in on the chest. You have to compress the chest because you're trying to massage the heart so that it does squirt out blood with each compression. So, cardiac arrest diagnosis would be as follows. Are you okay? Are you okay? Then we always look, listen, and feel. They're not breathing. Airway is open. We'll check the carotid artery for pulse. We do not have a pulse, so I have to do CPR. I find the correct location. 1 and 2 and 3 and 4 and 5, 6 and 7 and 8 and 9 and 10, 11 and 12 and 13 and 14 and 15. 2 breaths. One and 2 and 3, 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12 and 13 and 14 and 15. 2 breaths. 1 and 2, and I would continue with that 15, and then 2 breaths, and then 15 more compressions and 2 breaths, so that I had done 4 cycles of 15-2, and then I would recheck pulse. The 15 compressions should be done in approximately 9 to 11 seconds. And you'll want to practice and rehearse to make sure that you get those compressions in about 9 to 11 seconds.